Thank you for joining us on the program, Dr. Mamora.
Thank you very much for having me.
All right, just because we have quite a few minutes before we wrap up on the program, but briefly tell us your overall assessment of the impact of the pandemic on the population.
Well, as we have always said, the COVID-19 pandemic has devastated lives and livelihood. No doubt about that. It has affected businesses globally, and so we are not also not out of the loop in terms of the happenings here. But so far, so good in terms of our response activities. You will recall that we started with presidential task force set up by Mr. President Muhammadu Buhari. But along the line, just a few weeks back, that transitioned into Presidential Steering Committee. And where we are right now is, happily enough, the cases that we see, and we confirm they have reduced to, just in the last 1 week, less than 20 cases confirmed nationwide. So that means that we're not doing badly. But then it's not yet guru, and that's why we issued the directories we did the other time, that people should not lay down their guards. They should still maintain, particularly the non-pharmaceutical interventions, use of masks, washing of hands, maintaining social distance, avoiding crowd, and all that. Because we have moved to the vaccine administration phase, but unfortunately there is shortage of vaccines. And then, so in fact, we are waiting. You recall that since the first time we had the first arrival, which was way back in early March, precisely 5th of March, the vaccines that we received then, barely about 4 million doses, we've not been able to receive additional batch of vaccines. So, but what we have on ground, almost, the first phase, which is giving 50% of the vaccines to our people, that we achieved almost 100% of that. And we are now giving the second dose because we said that it's better for us to have a pool of fully vaccinated Nigerians rather than have vaccinated. So,
but if, Doctor, I just wanted to jump in there. If we're not reaching herd immunity because we don't have adequate vaccines for the necessary population, then, what exactly are we doing?
Well, we're still making efforts in terms of reaching out to the multilateral facility, the COVAX facility, and of course the African vaccine acquisition tax team, which is also helping the member states of the African Union to get the vaccines. Because we will not, of course, our quest to attain herd immunity of about, vaccinating 70% of the eligible Nigerians to be vaccinated. We are looking at that in the year 2022. But where we are now with the vaccine shortage, we are still far from achieving that. But we are hoping that with the efforts and with the hope, with the hope that the Serum Institute of India, which supplied the first batch of vaccines we had, will very soon start shipping vaccines to Nigeria as well. Right. And then we will go on with our quest for vaccinating the number of people to achieve herd immunity.
About infectious variants coming into the country, I know there was a time you put out a circular about some 90 travelers not knowing their whereabouts, but have you been able to locate them?
Well, we have improved our surveillance system and follow-up, and you recall that a few weeks back we had to publish the names of those who evaded quarantine and those who even refused to be quarantined and all that. So we are applying sanctions where necessary, and we have improved on the portal in terms of surveillance on those coming in, particularly from those countries of interest, Turkey, Brazil, India, and then following up and then giving and ensuring that they keep to institutionalized quarantine, which is what is needed for people coming from these areas. And of course, we improved the check on the vaccine, the evidence of vaccination from where they're coming from, the evidence of tests that they did, and to ensure that we are not having fake results in our hands. We have a process of checking what is brought to us to confirm that they're really genuine. So these are some of the measures we are putting in place.
Finally, before we let you go, health workers continue to play an important role in the pandemic fight, but there seem to be reports that a lot of healthcare professionals are leaving the country. Are you worried by this?
Well, yes, we are worried, and that's why we are trying to do everything we can to improve their welfare package, and then, of course, ensure that their emoluments, are paid as at when due. You recall that we had a meeting just about 2 weeks ago with the health workers, the union, joint health sector unions, and of course the NARD, NMA, and all the workers in the health sector. We were trying to now beef up to the hazard allowance that would be made available to all workers in the health sector. These are some of the measures we are trying to put in place, aside paying for the residency program. That's postgraduate training of doctors. We are paying for this free. The federal government of Nigeria is paying for this free. And that's one of the incentives that we are giving to ensure that they stay in the country.
We'd like to appreciate your time on the show. Wish we had a lot more time. The Minister of State for Health, Dr. Oloronimbe Mamora, thank you for joining us on the program.
Thank you very much for inviting me.